Dear friends, Maridani Pathikama, I am so happy to meet you today, May 4th, Saturday. So, this is a good opportunity for me to tell that we have completed 1,387 cases of Puberphonia as on today. So, we are very happy. Almost weekly, three cases are coming for treatment for Puberphonia. So, because we are going to extend our Puberphonia research with few more addition of instruments. As I have already told you, our main purpose is train the boys as little as possible, train for them. They are already hurt. Emotionally, they are disturbed. So, how can I win over them? We have to win because many boys are coming for treatment from distant places. So, we have to treat it completely and send them on 5 days. So, I am expanding my research area of Puberphonia with additional equipments. What are the equipments? Because 10 years back, you know that Dr. Rajaram, IAS, already inaugurated our Kinect games with Xbox 360 degree. So, where we are able to give little more experience of virtual reality for these boys. So, once again, we are starting Kinect games with the Xbox for Puberphonia boys. They are very much interested in doing the Xbox games. Number one, there are some games which are mainly intended to shout and play the ball. Each shout, the ball goes and it creates a counting for them. So that is a very good initiation for them and they are happy. It is a play, not only a play for them, and they will be excited and they want to have a little competition than the other boys and getting the number one rank. So with all the things in my hospital, about 2,500 square foot, we are going to create a artificial intelligence, a virtual reality place for Puberphonia boys, not for adults. So only for Puberphonia boys, where we are treating in a 5 days, we are putting them in a strong artificial intelligence because we have already installed the advanced voice analyzer. So we will be able to, as soon as the voice reaches us, without we actually record what they are telling. Already I have told them everybody bothered about their voice. They are having child voice. So our intention is the child voice should be changed. So if you are going on inquire little more on phone call, they will say the opposite party recognizes us as a lady. That is another big problem. So we are finding out the frequency with the new equipment, and then we do evil manipulation and make them to have the low frequency voice. Okay, if they got the low frequency voice, we have to maintain it. See, all vegetative sound will produce low frequency voice. Now, our idea is, our treatment is low pitch voice has to be habituated by training. Nothing but training, no operation, no medicine. So, what is the modified breathing? After successful EULA manipulation. So, we have made some artificial larynx, pharynx. The important finding we had is we are very much excited to know with this thing we have found out a new suggestion for the voice break. Voice break means that is what the treatment. So adult, when the boys attain adulthood, voice break. Break means it is not breaking the voice. It is a change in their life feeling that you should be able to understand. It doesn't mean it's break. Voice doesn't break. The famous word is there called as daybreak. Every day morning, sun rays and daybreak happen. And all the people feel they are having fresh in the early morning. They started to go for work, school, or they'll get ready for the day work. That is called daybreak. The daybreak is created by the rising of the sun. Early morning, daybreak happen. Similarly, I feel voice break happen. Very, very nice thing. How voice break happen and how they are happy. Every boy is happy if they had voice break. So our feeling also, there are two type of voice break. One, as soon as the child is born, there is one voice break. How it happened, all will know. As soon as the child is born, the child cry. So that is the first voice break. Second voice break is when they change, they get the adulthood. So there are two types of voice break. We should be able to understand it clearly. How the first voice break happens means, voice break means it is a change in life. That's all. Just like daybreak. Night you are having, as soon as the sun rises, you will have daybreak. In voice break, what happened? Try to understand. Voice break happened. Second voice break. first voice break is at the level of the vocal cord. The air from the lung pushes the vocal cord and make it vibrate, makes sound. That sound is high pitch. That is, the sound is for life. Both male and female having the same frequency. Then the child slowly start talking. Still the high frequency voice comes. So there is 100 muscles which help in voice production, starting from the abdomen to the tip of the nose. All structures help. But after first voice break, the vocal cord vibration is the predominant factor. See, all tissue in the vocal tract help to produce voice. But up to adulthood, laryngeal voice production is predominant. That's the thing. So it continues, that's all. So it is a high frequency voice. Second voice break, that is called adult voice break. That is called male puberty. Try to understand. Adult voice break is only in male. That is a male puberty. By this voice, the high frequency of the voice become low frequency. The mechanism is only by EULA. So until puberty, the predominant voice assisting organ is vocal cord or larynx. So it is a laryngeal voice. Then adulthood in male, the second voice break happened. Male puberty happened. It create a new sensation. The boys, what happened? They appreciate the glimpse of manliness in their life. So some wonderful thing happened by change in voice from laryngeal to pharyngeal, high pitch to low pitch. The glimpse of the manliness they feel in their life. So when the frequency changes from laryngeal to pharyngeal, wonderful things happen. Male feel, because of the low pitch voice, some manliness, how great it is. Just like daybreak happen, risings and produce some energy in the body of the human being or all animals. There's happily they leave the home and they come out. So similarly, a voice break happen, the laryngeal voice become pharyngeal voice. No wonder what I am thinking is a true. When you are having high frequency, the structure I told, predominantly the structure involved is larynx. That means larynx, neck area and chest area vibration happen. You can feel the vibration in the larynx and chest. After the second break, what happened? Predominantly the speech organ will be pharynx. Hello. So you will be able to appreciate the vibration in the ear and head. Hello. So if you are able to feel the vibration yourself in the ear and head, that means the second voice break had happened. To produce a vibration in the ear and head, the area involved similar to laryngeal cavity, there is a pharyngeal cavity which is the main source of low frequency, not the whole pharynx, it is in the nasopharynx. Yes, just like a potential cavity in the larynx, there is a potential cavity in the nasopharynx, where the vocal cord vibrate in the larynx. Similarly, uvula vibrates in the pharynx, where the nasopharynx act as a good resonator because it continued to the nose anteriorly, above. Anteriorly, it continued to the oral cavity. A good resonators are there in the nose and sinus and oral cavity. Along with that, there are a lot of holes are there which monitor the frequency. There are so many narrow places which open and close in the mouth, in the buccal cavity, underneath the tongue. Similarly, in the nose, there are three gutters: superior terminate, middle terminate, inferior terminate, and space also there. So these areas, there are holes. By the holes, the air enter into the sinuses, where the most important resonators are there, the maxillary sinus. So why I am telling you, by the second voice break, the organ which is involved is nasopharynx. The potential cavity is in the nasopharynx. To create a vibration in the nasopharynx, the vibration should be felt in the ear and head. You will really feel. To feel the vibration in the ear, nasopharynx, one important structure is there called as eustachian tube, which connect nasopharynx to the ear. From the ear, you know that very sensitive organ is there, which transfer all the information to the brain very quickly. Very important finding I had. I'm really so happy. So, in Puberphonia, not only thinking of so many subjects, we have to create a low pitch from high pitch. That is the Puberphonia treatment. That you will get even making a vegetative sound. Creating high pitch to low pitch is very simple. The Puberphonia boys Most of them have a double voice. They themselves will come and tell, I am having two voice. So now our main target is the created low frequency from high frequency. We have to make it as a habit by training. For that, we have created virtual reality, mirror talk, mud pod talk, echo speech realization, seeing the sound. That is called voice synesthesia. That is our first research project with Dr. V.S. Ramachandran of Valayanur in California. Calligraphy, use straw exercise. Istanbul ENT surgeons are very expert in straw exercise. Straw exercise will help to balance the throat muscles and breathing. Then we have created app for to improve speech and ways to develop self feedback, way to project instead of yield. Then lastly, speaking from heart. You can speak from the heart. That is 100%. You will have a peaceful habituation. So you have to speak from the heart training. We have created a special department with what are the instruments. I am just going to tell you how to speak from the heart. What is the training we follow in Siva ENT Hospital at Chennai. The emotion you feel are stronger than your thinking mind. So they will inform your mind of the right words and voice tone so that you can speak from the heart. You may be thinking that speaking from the heart is corny or make me even slight weak. However, your heart speaking your head all or to your head all the times. Very important finding. So first artificial intelligence for our Puberphonia treatment, we used tooth anchored sound therapy. Along with all playing Kinect games with the Xbox 360, we give all the boys tooth anchored hearing. Very simple process. Next, piano. They'll be playing piano. Piano will help in treating puberphonia voice disorder. We have created voice booth soundproofing where we have displayed Croco microphone. So all the boys are excited and happy to sing. We are provided them with music system. So they will sing along with pre-recorded the songs what they want. And using microphone, its musical content is an instrument of a well-known popular song we will play. So they have already know the song. So it is easy for them to sing in the low pitch. Here also I have found another interesting thing which I am going to publish it is quickly as early as possible. That is, all over the world the doctors know in stammering they will able to sing well without stammering. Speaking only they are having the problem. They will have stammer. They will repeat the word with strain and everything. But when they sing, it will be normal. So, what is the point I have noted, I have researched and finding is normal speaking, we breathe and talk. Normal singing, we breathe and sing. But in stammering person, when they speak, they fail to breathe. They fail to breathe. That is the main thing. But singing, automatically they breathe and sing. So there is no stammering at all. So stammering treatment, the first thing they should be taught is they should breathe and talk. So you know that God had given some inspiration to us how to treat Puberphonia. Similarly, stammering also, how to breathe and talk, we are having some idea. We'll able to explain it as early as possible. Then all over the world, all stammering cases can be treated without any problem. How a wonderful things happening in the world. If you are really interested, God will give everything to you with full satisfaction. So today, Saturday, we are able to treat 1,387 cases of Puberphonia on 4th May 2024, and three boys are there in our center and continuing their training for Puberphonia. So with this, we will end the talk today. I will meet next Saturday, 5 to 5:30. Thanking you, great, for hearing. I will try to tell few more new things. Whether any ENT surgeon or somebody interested, they can also try my method and give some new things to the world. Thanking you, great.